I felt like a pounding in my chest, and it was like radiating up. I thought I was gonna have a stroke or something. And I looked at Michelle and I said, I need to get to like the nearest hospital. I think this is it.
Doug rushes to the closest ER, where they administer a pulmonary function test, which measures how well oxygenated blood is able to move from the airspace of the lungs into the heart. The results are shocking.
The saturation rate should be like 80, 90, shows the level of oxygen in your blood. I was in the 50s.
Doug is admitted to the medical center for testing and observation.
One of the doctors came in and you know, right away put his light in my eyes. I remember him saying to me, you know, your pupils are just so dilated. There's something majorly wrong here. There's a neurological problem here.
But again, all the tests administered return with negative results, and Doug is released from the hospital.
After I was discharged from the hospital in the city, I was back home in New Jersey and, you know, started again, you know, stabbing pain, chest pain, shortness of breath. Felt like my throat was closing. So back to the ER, and the doctor who was there at the time was terrific. He stepped in and said, there's something clearly wrong, there's something autoimmune. We need to admit him and really do an all full-on workup.
When one of the doctors told him that he might have MS or some type of autoimmune disease, I was scared for him because he was about 28 years old at the time and he had everything to live for.
Doug is admitted to the hospital in New Jersey for extensive testing.
I just felt if something was going to happen, at least I'd be in the hospital, I'd have a chance that they'd be able to help me and save me. I felt that if I was at home, there were many nights where I went to bed thinking I might not wake up.
Doug's time at the medical center begins with days of heavy cardiac testing.
They did more tests on me than I knew ever existed. I really felt like the world's largest guinea pig.
Many, as usual, come back normal, but a spinal CT scan reveals inflammation of the lungs, enlarged lymph nodes, and an enlarged spleen.
What they had found was, through their studies, that I had pericarditis, the inflammation of the sac around the heart, which was pretty scary to me. And at the same time, a second pulmonologist said I had a touch of pleurisy, which is inflammation of the lining around the lungs. So when you put it all together, it's different varying degrees of inflammation with different vital organs.
However, an infectious disease doctor reports Doug's blood tests are coming back negative for all diseases.
When I stayed at the hospital in New Jersey for the week, it was like a revolving door of different doctors. And, you know, they were all doing their workups. They were finding some things here and there. Again, nobody really pieced it together. It was like the doctors had a tug of war. You know, it's autoimmune, it's in his head, it's autoimmune, it's in his head. And I just sat there pounding my fist literally on the table saying, there's something wrong, it's physical, and you're gonna figure it out when I'm dead.
After 6 days, scores of tests, and no conclusive results, Doug is discharged. He's told that something's definitely wrong, but it's at such an early stage that the doctors can't identify it. And right now, there's nothing they can do.
I was forcibly discharged. They pretty much had to like pry me out of the bed and throw me out of the hospital. Because I said, look, I don't want to leave. When you find out what's wrong with me, I'll leave. Nobody came to me with a diagnosis. And that was a very difficult thing for me to accept.
Doug and Michelle return home, discouraged.
Doug decided to write his will out on a napkin. And that really depressed me because I saw that he had given up.
Doug's mood was morbid. He really felt that this is it. They're not going to help me, I'm done.
After being discharged from the hospital, my personality was gone. I just didn't have one anymore. I mean, I just sat there and stared at the wall. I just felt so kind of isolated, alone.
He had no appetite at all. He looked really drawn in, looked almost like a cancer patient. His gray hair started graying more. He looked terrible.
Then, one day, while out to dinner nearly 4 months after the onset of his symptoms, an old friend approaches him.
I was at a restaurant, and I ran into an acquaintance, and, you know, he took one look at me, and he had heard what I was going through, and he said, you know, I think I know what the problem is. And I remember him vividly reaching in his pocket, taking out his business card, turning it over, and writing a doctor's phone number. You know, Dr. Leslie Fine, you need to see this woman. Like yesterday, she's going to save your life.
Doug makes an appointment to see Dr. Fine in early May 2004.
And I remember walking into her office and filling out the paperwork, and she had a symptom checklist of about 50 symptoms. of which I had about 35. And I remember handing the sheets back to her receptionist, and about 3 minutes later, Dr. Fine came out, from her office and got me.
When I saw him sitting in the waiting room, he was very pale, very sweaty. He had loss of balance. He was confused and unable to verbalize, unable to answer questions, shaky. He just looked like somebody that needed to be seen immediately.
Dr. Fine said, "I need to talk to you," and brought me right in right away and said, "You need help. I would bet my house I know what's wrong with you."
All new tonight, a heartbreaking Unfaithful.
Dear Kathy, I know this is a shock to you, and I am so sorry. I never thought this would happen, but it has. I've decided to leave with Stacy. You are going to be fine. It will be hard for you to tell everyone what we have done, but don't worry. You're a good person, and a good mom, and a good wife. Someone will be happy to be married to you.
Unfaithful, true stories of betrayal. All new tonight, 9/8 Central, only on OWN.
There's a science to the perfect swish. It's about zero weight, 100% more nourishment, hair that's not weighed down. Introducing new Aqualite from Pantene. Our lightweight conditioning formula nourishes, then rinses clean in seconds, leaving hair perfectly conditioned to swish. New Aqualite, Pantene. Hair so healthy it shines.
Here's mine. Now you show me yours. Come on, swish your hair and upload it on Pantene's Facebook page. Swish!
With Swiffer Wet, cleaning better doesn't have to take longer.
I'm done. I'm gonna use these.
Unlike mops, Swiffer can maneuver into tight spaces without the hassle, and its wet mopping claws can clean better in half the time, so you don't miss a thing.
Mom? Ah! No, it's Mommy!
Swiffer, better clean in half the time, or your money back.
Round, round, get around, I get around.
New and improved Swiffer dusters with Dust Lock adhesive can clean virtually every surface in your home. It's thousands of fluffy fibers. Pick up dust here, there, pretty much everywhere. And Swiffer dusters traps 3 times more dust than a feather duster and locks it away. Swiffer cleans better, or your money back.
With Secret Outlast, conquer your busy day.
Let's do it! Hello, Jenny!
Thank you.
Working on it. Hi.
How are you?
Outlast your day, any day, with Secret's 48-hour odor protection technology. New Secret Outlast.
Hi, Mark Gill here for Growth Bully, the fastest and easiest way to clean, renew, and redesign your growth, guaranteed. Simply line up Growth Bully with your growth line, press down gently.
Every day, Wendy Slyke inspires her students to make the earth a better place. The environment, how we treat it and need it, is what fuels her enthusiasm.
I'm passionate about the natural world, and I think providing opportunities for students to be engaged and be like, wow, there's a whole world out here that's not in front of our computer.
Inspiration that will ensure a brighter future for her students and our planet. The Sequan Band of the Kumeyaay Nation congratulates Wendy Slyke as their Environmental Educator of the Year.
When it comes to digital services, who's your friend? And who's your foe? Does Cox offer the fastest internet speeds around?
You bet we do.
Do you guys have super fast internet speeds?
No, but we do sponsor legendary race car driver Crash Strickland.
Crash attack, baby! Woo! Sleeping on the job.
For all your digital services, go with a friend in the digital age.
Drink what he drinks. I just want to do what he does. Damn it, I didn't come to work.
Are you ready?
I'm gonna do it!
All leading up to this.
Oh my God! Oh no, oh no!
Oprah's Next Chapter, tomorrow, 9/8 Central, only on OWN.
Doug Poslusny has been suffering for 5 months with blinding headaches, stabbing chest pains, and tingling in his extremities, and no one has been able to tell him why. He has all but given up hope when he meets Dr. Leslie Fine, who thinks she knows exactly what's wrong.
I felt very confident in her right away, when I met her and I saw how aggressive she was.
Dr. Fine immediately sends Doug to get a spinal tap and a brain SPECT scan, a radiological study which looks at the flow of blood in the brain.
He had a very abnormal SPECT scan. Evidence of inflammation of the brain, which is what we call encephalitis.
I vividly remember getting the call. I was laying in bed and just really could barely move. And I remember her calling me at 8:30 in the morning because the test showed flying colors positive for Lyme disease.
Lyme disease is caused by the bite of a deer tick infected with the bacteria Borrelia. The tick embeds itself in the skin and discharges the Borrelia into the bloodstream, which can then wreak havoc throughout the body.
There are a lot of different strains of Lyme, and maybe some strains go to the nervous system more readily than others, and some strains go to the joints.
Typical symptoms include headache, fever, and fatigue, but in its advanced stages, Lyme is even more difficult to diagnose because of its ability to cause other illnesses.
Manifestations of Lyme are often not just directly from the infection. It was first described in the early 80s, and it was known then that Lyme disease could trigger rheumatoid arthritis and lupus and other autoimmune diseases. Because it has the ability to trigger other things, it's not just simply an infection.
And testing for Lyme presents a whole new set of issues.
I was tested many times by different doctors for Lyme, and they said, no, you're negative.
There's no one test that will specifically diagnose a case of Lyme. There are multiple tests that can be performed, and people can test negative on all of them and still have the disease. We don't know why all the patients who test negative test negative. Some of the reasons are because we're not testing for all the strains yet.
In Doug's case, there was something else that made diagnosis elusive.
The test picks up the antibodies, and if you get very sick and your immune system is basically non-existent, you're not producing antibodies, so you're not going to pick them up in a test.
Most cases of Lyme are accompanied by a bullseye rash at the site of the bite, which many mistake for an ordinary bug bite.
Doug recalled having a lump on his scalp in November.
I noticed in the shower, shampooing my hair, and I had a lump, and I remember feeling it and saying, this really hurts.
He asked me to look at it, and I told him, well, it looks infected.
And I will never forget this. She said, you have a lump there. It's strawberry red, about, size a little bit bigger than a quarter, with a clear center.
And then developed symptoms around February or March. This would be a classic presentation of an undiagnosed, untreated tick bite.
Treatment for Lyme presents almost as many difficulties as diagnosis.
The treatment for Lyme is complicated and controversial. There is no consensus within the medical community about what the appropriate treatment is, what the duration is.
I started on oral antibiotics, and they help slightly, but based on where I was at and how long I was sick and with the neurological involvement, I very quickly switched up to IV, intravenous antibiotics.
Doug was diagnosed and treated just in the nick of time, but not all patients are so lucky.
Doug would have gotten progressively more tired or confused. You generally see people just becoming progressively unable to function. You die, usually if you have cardiac involvement that's not diagnosed.
It was like a weight off my chest. I felt like I had like a garbage truck parked on my chest, and it just like rolled off me, and I felt like I could breathe a little easier.
Today, nearly 3 years after starting the antibiotics, Doug's life is finally back on track.
I'm 100% back to normal, thank God. After about 1.5 years of treatment, 6 months of intravenous, and about 1 year of oral antibiotics, I'm back where I need to be. Life is good, and back to normal.
I want to warn you that the twists and turns in today's story are going to shock you.
Today.
This can happen to any child, anywhere, at any time.
A child in danger.
You had no idea that he was going into her bedroom at night.
A mother in denial.
You walk in on your 9-year-old daughter and find your husband